The London patient, who was creature purified for carcinoma, has now been in period of remission of HIV for 18 months and is no much longer take HIV drugs. The researchers say it is too previous to say the patient is healed of HIV. Experts say the attitude is not pragmatic for treat largest human beings in HIV but may one day assist discover a treatment. The man London patient, who has not been mentioned, was undiagnosed in HIV in 2003 and progressive lymphogranulomatosis lymphomas in 2012. He had chemo to consider the lymphogranulomatosis carcinoma or, in supplement, Stalk cells were implanted in the patient of a funder persistent to HIV, guideline to both of his carcinoma and HIV departure in period of remission. Researchers of College School London, Empire School London, Cambridge and Oxford universities were all implicated in the instance. The other period a patient purified the way has ended up in period of remission of HIV. 10 years back, L's patient in Berlin acquired a ivory marrow replant of a funder in nature immune to the viral infection. Timothy Tan, told to be the first man to hit HIV/AIDS, was taking into account 2 transplants and full flesh exposure, radiation therapy, for leukemia, a lot more than violent treat. By reaching period of remission in a other patient with a such attitude, we include shown how the Berlin patient was not an abnormality and how it very was the treat approaches how removed HIV in these 2 human beings, told conduct research writer Professor Ravindra Gupta, of UCL. Though the conclusion is breathtaking, it is not offer up a new treat for the millions of human beings about the planet residing in HIV. The violent treatment was mainly utilized to consider the patient's carcinoma, not his HIV. Present HIV therapies are very efficient, important human beings in the viral infection can dwell length and wholesome lives. But the cause the instance is so considerable is how it could assist expert who are looking for new ways to gear HIV and reach a treatment. Insight how the flesh can natural oppose the contagion does propose up expect of the, though if it is yet a length way away. Professor Eduardo Olivaria, as well implicated in the study, of Empire School London, told the successful of Stalk cage transplant proposed expect how new strategies could be advanced to gear the viral infection. But he added, the treat is not relevant as a norm HIV treat since of the toxic of chemo, that in the instance was required to consider the lymphomas. CCR5 is the largest usually utilized receptor by HIV. 1. The viral infection tension of HIV how dominates about the planet, to come cells. But a really little quantity of human beings who are persistent to HIV include 2 mutant copies of the CCR5 receptor. The viral infection cannot permeate cells in the flesh how it usually infects. The London patient acquired Stalk cells of a funder in the particular gene variation, that done him persistent to HIV as so. But a water reservoir of cells transport HIV can yet stay in the flesh, in a vacationer country, for lot year. The UK researchers say it may be probable to use gene expression treatment to goal the CCR5 receptor in human beings in HIV, now they aware the Berlin patient's restoration was not a off. Professor Graham Cook, Domestic Institution for Public Health Study Prof and female readers in communicable diseases of Empire School London, told the results were hopeful. If we can know superior why the order plant in several patients and not other, we will be nearer to our final purpose of cure HIV. At the time the order yet carries too lot hazard to be utilized in patients who are differently so. Dr. Andrew Libertine, female readers in communicable diseases, and honorable advisor doctor at Cardiff College, told it was an exciting and potential considerable paper. But he told lot much longer pursue up would be necessary to provide the viral infection did not de-emerge at a after phase. Time the kind of treat is obviously not pragmatic to consider the millions of human beings about the planet residing in HIV, accountable such as these may assist in the final growth of a treatment for HIV. In the meanwhile, he told the attention necessary to be on diagnosing HIV quickly and start patients on life conjunction antiretroviral treatment, WAGON. that can hinder the viral infection creature transferred to other and offer human beings in HIV a close normal lifetime expectation.